This is the Fertility Friday podcast, episode number 18. Welcome to the 18th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. So please stop by the blog and leave a comment if you enjoy the show today. You'll find the show notes for today's episode and all the podcast episodes at fertilityfriday.com/podcast. And you can also tweet me at Fertile Friday if you like the show. And I'm very excited to welcome Dr. Rosita Arvigo to the show today. Dr. Arvigo is a doctor of naturopathy, an herbalist, an international lecturer, and a teacher of Maya medicine. Dr. Arvigo is the author of 6 books on traditional healing of Central America, and she is the founder of the Arvigo techniques of Maya abdominal therapy. Dr. Arvigo is dedicated to the preservation of traditional Maya healing for the benefit of women and men all over the world. And her work has been instrumental in keeping ancient Maya medicine alive. And so in today's show, we're going to be talking about Arvigo therapy, including the Arvigo techniques of Maya abdominal massage and vaginal steaming. And now the topic of vaginal steaming was recently brought to my attention after I read an article where Gwyneth Paltrow was talking about the benefits. And so since it was something that was new to me, I started researching the topic, and I was very excited to find that vaginal steaming has many benefits for women, from improving fertility and treating problematic menstruation-related issues and so much more. And so I'm really looking forward to today's interview so that we can all learn more about these techniques from Dr. Arvigo. So without further ado, welcome to the show, Dr. Arvigo.
Hi, Lisa. Thank you for inviting me, and hi out there, everybody.
Oh, well, thank you so much for joining me today. And I did give a little bit of an introduction, but you've been working in this field, as you mentioned, for over 40 years. And so I would love for you to just talk a little bit about your background and also, I guess, what inspired you to focus on this field and stay in it for such a long time.
Okay, well, we're talking from where I am in Belize in Central America, and I've lived in Belize since 1976. And in 1981, I met an old Maya shaman by the name of Don Eligio Panti and became his apprentice for a period of 13 years. It was Don Eligio who taught me the Maya abdominal massage for the primarily for the uterus to ensure maximum position, strength, blood flow, venous flow, nerve innervation. And so after being with him for 13 years, I practiced here in San Ignacio in Belize for another 10 years, and then I started introducing it to the world as Maya abdominal therapy. And it is a technique that helps the uterus to keep in its proper position within the pelvic floor. And I've been teaching the techniques ever since 1992, so that's about 23 years. And right now we have practitioners in 22 countries around the world.
Mm-hmm. That's very impressive, and I've actually interviewed one of the guests I had on the show, Amy Sedgwick. She is a practitioner of Arvigo abdominal massage. And so it's something that I've been familiar with, but it's not something that I ever knew that much about. And so kind of talking a little bit about, because these techniques, as you mentioned, you were apprenticed, and these techniques come from ancient traditional Maya wisdom. And why would you say it's important to preserve these ancient traditions and this ancient wisdom when it comes to maintaining and preserving health?
Well, I think that the Maya people have always been brilliant 5,000 years ago, and they still are today. And my experience is that every generation has, say, a generation in a tribe or a generation in a village. In each generation, there is at least one genius like Don Eligio and another of my teachers, Hortense Robinson. And when a genius like Don Eligio dedicates his entire life to finding better ways to help people heal and stay well, there's great value in that, and there are absolute treasures that these people have been developing for the last 5,000 years of civilization. And just because it's old doesn't mean that it doesn't have value. So I think that the fact that the Maya people have been able to take care of health problems with these very natural, non-invasive techniques long, long before modern medicine or drugs were ever introduced into the culture, they were taking very, very good care of each other through midwives, traditional healers, herbalists, and snake doctors. And what an absolute pity and a great loss to humanity that these techniques and these systems would be lost. It's kind of like burning up a library and saying, oh, well, so what? So it's been my life quest to try to keep these techniques buoyant and alive.
Mm-hmm. Well, and you mentioned that the basis behind Arvigo abdominal massage is based on the positioning of the uterus and making sure that it's in the right position. Maybe you could talk a little bit about that. When I was researching for this interview, I was reading about the diagnoses sometimes that women receive, say for tilted uterus or those types of things. And basically, there's really nothing that modern medicine is offering to women that have these types of issues. And so how does the Maya abdominal massage actually offer support for women who are in those situations?
Okay. It's Maya abdominal therapy, and the female uterus is one aspect of the benefits of the abdominal therapy. Our therapy goes from the stomach all the way down to the pelvic floor. So it also is a great boon for digestive problems. But because the female uterus is kind of slung like a hammock in the pelvic floor, held in place by 12 different ligaments in 6 pairs each. And because it swings, it's meant to be movable, it's meant to be able to grow every cycle, and then of course grow large enough to hold a complete human being in there. So the uterus tends to naturally come out of its proper position. So that could be going downward into the vagina. It could be leaning to the right, leaning to the left. It could be abnormally leaning on top of the bladder, and it could also be leaning backwards against the colon. So what we do is simply massage externally. There's no invasive aspect of our therapy, and we can palpate with our hands the position of the uterus, and the technique is very simple to learn. And then our favorite part is the self-care that women take home with them after a session with the practitioner. And we request that our clients all do self-care at home, simply because the uterus is daily subject to stresses and strains on the ligament that may pull it out of position from day to day. So doing self-care regularly is the best guarantee to keep the uterus in proper position. Now, a uterus in proper position is a fertile uterus. It's a uterus that menstruates painlessly. It's a uterus and ovary that ovulate regularly and painlessly. So we see that function is normalized. When function is normal, there should be no pain, no discomfort, and there should be fertility that is abundant and easy to access for everybody.
Mm-hmm. And so for anyone who's listening, when you have the abdominal therapy, what does it feel like? Does it just feel like a massage? Is it comfortable? Is it kind of deep? Or is it, I guess, is there any pain associated? Like, is there any discomfort, or is it just comfortable? And
well, first of all, it's not a relaxing, feel-good massage, but it's not painful. The only time it would be painful is if the uterus has been adhered to an abnormal position by adhesions. Then yes, of course, you're pulling on adhesions. But otherwise, no, we find that it's not painful. And if it is painful, we prefer to refer someone to a midwife or a pelvic floor therapist, because the abdominal therapy should not be painful unless perhaps, for instance, the uterus has been lying on top of the bladder for so long, they've actually grown together. Then when you separate those tissues, sometimes there is mild discomfort. But the discomfort should most definitely have disappeared at the end of, say, a 40 or a 50-minute treatment. If it does not, then our instructions to the practitioners are that it is best to refer until we find out why it is painful, because it should not be painful.
Mm-hmm. One of the exciting aspects of our Arvigo abdominal massage, especially because my podcast and my blog is so, heavily tied with fertility and fertility awareness, is the ability for the abdominal therapy to actually improve fertility, not to mention help with menstrual conditions. Maybe you could talk a little bit about even examples of women who've come to you with different issues related to fertility, and having the abdominal therapy alone actually helped to improve their symptoms or even bring a return of their fertility.
Okay, well, as you know, every woman is a unique puzzle with fertility. There are no simple and straightforward answers. However, we do find in clinical practice that probably 5, maybe 7 out of 10 women with a fertility challenge actually have a misplaced uterus. So that sometimes the uterus is lying right on top of the ovary, and the ovary is not able to ovulate properly, or it ovulates and the egg is not able to find its way into the fallopian tube. Sometimes the fallopian tube is kinked, and all it needs is a good stretch, nice, soft, and easy pull to put it back into prime condition. And of course, a uterus that is lying anterior or backwards or too low also is not cleaning itself out properly. So usually we find women with fertility challenges also have dysmenorrhea or painful periods. And there then comes in place the vaginal steam. Part of our therapy is to recommend vaginal steaming, because the vaginal steam, although we call it vaginal steam, it really doesn't have a whole lot to do with the vagina. The purpose is to bring the steam and the essential oils of the plants into the cervix and into the uterine body itself by means of cleansing. So back again, a uterus in malposition is very likely to have difficulty with normal menstruation. Once we bring it into proper position, recommend a vaginal steam, and if the woman is willing to do self-care regularly at home, we find that the 9 out of 10 women with dysmenorrhea will improve with the abdominal therapy. How many will be able to resolve a fertility challenge? It's really difficult to put an exact number on it, but it looks like after 45 years of experience, about half of women with fertility challenges really need a good deep abdominal therapy to bring the uterus, the fallopian tube, the ovaries, the broad ligament, the uterosacral ligament, bring them all into proper position to allow a good amount of arterial supply, which brings all the life and the nutrients into the uterus, and to drain away the venous blood, and then also to help with the lymphatic congestion, to bring that to a normal state. And therefore, what you have is a return of homeostasis. Homeostasis simply means balance within. It's normal for women to reproduce. It would be abnormal for a woman not to be able to get pregnant. So when we are able to accomplish these things, then nature, homeostasis, is then put back into proper order and condition, and things normalize, function returns.
Mm-hmm.
That's my story.
Well, that's incredible. because we're talking about a non-invasive procedure that is, I mean, one of the things I talk about a lot on the show, diet and all of these different things. And it makes a lot of sense what you're saying, that of course, in order for your body to function properly, everything has to be aligned properly. And if there's any congestion, if there hasn't been proper expulsion of menstrual blood, it would make sense that this would impair your body's ability to function, I guess, optimally. So I think this, as you said, it's a travesty that the traditional wisdom is kind of lost in modern day culture, because I would much rather opt for a much more non-invasive procedure, at least to begin with, if I had a challenge. And I think many women don't even know that this is an option.
That's true. Yes.
Mm-hmm. And of course, one of the topics that I wanted to chat more about today is vaginal steaming. And so you talked a little bit about it, and maybe you could walk us through to give kind of the visual of what a vaginal steam is, what it looks like, and I guess what the experience is like for women who are doing the vaginal steam.
Okay, so a vaginal steam, remember, the goal is to cleanse the uterus. It's called a uterine lavage. Lavage comes from the Latin word lavar, meaning to wash or to cleanse. So we use a pot of water to which we could add many different types of aromatic herbs with essential oils. In Central America, the favorite would be oregano, the same oregano that's in your kitchen cabinet, basil, marigold, rosemary. Any one of those four, or any 2, 3, or 4 in combination. So you need a quart and a half of water and 1 cup of fresh herbs, or 3 tablespoons of dry herbs. You bring the water to a boil, put the herbs in the water, cover it, and let it simmer slowly for 10 minutes. In the meantime, you need to prepare yourself a chair. The chair should have slats in it so that steam can come through. Lawn chair would be fine. Some people are able to put the pot right into the toilet bowl, set it in. You can't pour the water in the toilet bowl because then it just flushes away. But if your pot fits comfortably in the toilet bowl, then you can do that. Otherwise, you sit on a chair that is open at the seat, remove all your clothing from the waist down, keep some warm socks on your feet, get a blanket, and you bring the steaming herbs from the stove, put it under the chair, cover yourself all around from the waist down with the blanket, keep your feet warm, that's very important, and then you sit on that steam for 20 minutes. Now, the caveat is you can't get burned. So if it's feeling really uncomfortable, you pull the pot out, wait about 10 seconds, and push it back in. It should feel really, really comfortable, warm, and soothing. In about 5 minutes, you can taste the herbs on your tongue. So the benefit is that the steam, the heat, and the essential oils enter right into the vagina, through the cervix, into the uterus, and kind of act like Brillo, if you will, on a pot or a stove. If you think of oven off, what happens after you spray oven off in a stove, and you see all that skunk and slime coming down, that's exactly what happens to the uterine membrane if it is endorated, or if it has a great deal of debris stuck to the uterine membrane. The steam, the heat, and the essential oils are able to loosen that material. Then on the next menstrual cycle, and we like to do the vaginal steams as close to a menstrual cycle as is possible. So it should be the day before or 3 times in the week before menses is about to begin. Then it's always important to tell a woman that there are definitely going to be changes in her menstruation. She is going to see what looks like coffee grounds. She might see what looks like chocolate syrup. Sometimes it clots. Sometimes it looks like hamburger meat coming out, but as we always say, better an empty apartment than a bad tenant. And so the woman has to be prepared that there might be more menstrual flow and that there is very likely to be a flow that looks very different. Let us just say that. Usually 1 week of vaginal steam is enough for a woman to cleanse the uterus. Sometimes, based on the report that she gives us after the vaginal steam, we might recommend another month. Then we think that there is a maintenance a schedule as well, where a woman should really, no matter if there are no pathologies, in order to prevent pathology, a vaginal steam is ideally done 4 to 6 times in a year. If there are pathologies, we think it should be done previous to every menstrual cycle until the pathologies improve.
Okay. Well, thank you for going through that. I was thinking of questions along the way, and you answered them all pretty much. And so just to kind of paraphrase, so the best time to do the vaginal steam, you said, is before menstruation. So it would be after the woman ovulates, preferably, you said, maybe 3 times in the week before, or even the day before, if you're able to know when your menses are coming.
Right. And we absolutely have to know that she's not pregnant. You must also be sure that after ovulation, you're not pregnant. That would definitely be a contraindication.
Okay. And so I guess I can ask the question then, when shouldn't a woman have a steam, or are there certain situations when women should not do vaginal steaming?
Right. If a woman has very heavy bleeding, we would like to correct that first. Bring that down to a normal flow before we administer the vaginal steam, because obviously it creates more bleeding. But the bleeding is the cleansing, that is the lavage. So that is a contraindication. Infection would be a contraindication, and pregnancy would be another one, and an IUD present in the uterus would be another contraindication.
Okay. And then conversely, what types of, I guess, problems or issues, I guess, could, if you were seeing a client, what types of situations then would kind of trigger you to suggest for the woman to have the vaginal steam?
Well, almost everybody. If she's in my clinic, she's looking for help. If she's looking for help with her menstrual problems or fertility or fibroids or polyps or endometriosis or irregular periods or late periods or no periods or anovulation or irregular ovulation, all of those are indications for the benefits of the vaginal steam. So pretty much anybody who comes to see me in the clinic is likely to be such a candidate. Okay. Including menopausal women. It's a very, very excellent technique to continue for the rest of our lives in order to prevent pathologies after menopause.
Mm-hmm. I think that I was either reading from your blog, or I might have heard an interview that you did where you talked about the benefits of a woman having vaginal steams prior to what's the word I'm looking for?
Prior to
menopause.
Prior to the cessation.
That's okay, right.
Yeah. That's the word?
That's the word. I'm having a blank moment here. But no, that seemed very interesting to me because, you know, after menopause, you're not menstruating anymore. And if all of that blood hasn't had the chance to kind of leave, or if you have any stagnant blood, I thought that was a really interesting concept because it's not anything I had ever really considered before.
Right, exactly. I mean, I had that experience myself. I had not been menstruating. I was postmenopausal and still doing vaginal steams. And for 3 cycles in a row, I was still passing fluids from my uterus. So we know that if that stays inside, it can only harden and then endurate right into the wall of the uterus. The uterus should be clean when it stops menstruating. And the only way to ensure that is to do the vaginal steams. Most women who are menopausal or postmenopausal may not have menstruated for a year or two. When they try the vaginal steam, are absolutely shocked to see that there were fluids left inside the uterus that had not completely flowed with their last and final menstruation, especially if they have had a history of painful, difficult, or irregular cycles most of their reproductive life. So it's very good for fertility. It's very good for all dysfunction of the uterus. And it's also good to ensure that after menopause, a woman maintains a healthy uterine environment.
Mm-hmm. And one of the things that you mentioned as well was fibroids and endometriosis. And so when it comes to fibroids, when a woman has fibroids, other than surgery, there's not a whole lot that's generally offered that could shrink them or reduce the size. And so how have you found the Maya abdominal therapy and the vaginal steaming for women who have fibroids specifically, or who have endometriosis as well?
For the fibroids, it depends on the size and also the location. We have the best results with those fibroids that are polyps. They're fibroid balls, so to speak, fibroid tissue that hangs from the uterine membrane by a stem. So those, in our experience, we have the most success dislodging from the uterus. Those fibroids that are actually growing in the wall, the intramural ones, of course, they're more difficult. And the other fibroids, it really depends on the size. We have good results with fibroids that are 5 centimeters or less. The very, very large fibroids, we find that we're able to help a great deal with the pain, the bleeding, and the symptoms, but that they only shrink to a minor degree. It just depends on so many parameters. You know, as natural healers, we don't treat fibroids, we treat people. We don't treat endometriosis, we treat women. So a question like that is difficult to put a blanket statement on, because it would so in so many ways depend on the woman, her history, her present state of health, her emotional well-being, her spiritual well-being. We like to take all of those things into consideration. But having said that, in general, women with fibroids and endometriosis report that the symptoms are tremendously improved, even if the fibroids have not disappeared. Sometimes they do, but it really depends on the size, the age of the woman, her health in general, and whether or not she is willing to accept the responsibility of what she has to do for herself, the self-care, the vaginal steam, usually taking a herbal remedy. It just depends on the woman, but also depends on how well she is able to be engaged in her own self-healing.
Mm-hmm. Well, it's something that part of the reason why I wanted to have you on the show, and part of the reason why I do the podcast, is that women need to know about the different options that are available. And I just feel very blessed that I was able to come across this, because one question I had for you is, obviously coming from Canada and North American culture, this isn't something that I would consider to be mainstream. Obviously, it's not something that, many people in kind of the general sense are talking about. But are there places in the world where vaginal steaming is more common and it's more of a regular, everyday type of thing?
Yes, there are. Central America, South America, Egypt, Morocco, Korea, China, Japan, lots and lots of places around the world. Vaginal steaming is not unique to Central America, but here where I live, vaginal steaming is as common as rubbing your head for a headache or drinking more water drinking more water for constipation. We still have very active midwives here and traditional healers. And for every woman who comes to see them for reproductive health problems, the first question is, well, have you done a vaginal steam? Well, go home and do a vaginal steam and then come back and see me. Yeah, it is de rigueur for women's treatment in Central and South America, Korea, Japan, China. Now that we have started the discussion in America and Canada, people all over the world are chiming in to say, hey, we've been doing that for generations. So it's not anything new, so to speak. It's something ancient that we and our Arvigo Abdominal Therapy organization have been able to reintroduce to the American culture because it works. It wouldn't be thousands of years old if it was nonsense. If it didn't really help women, it would have died out 3,000 years ago. But it's been going on since about 2000 BC, I would guess, and we're now in 2000 AD. That's 4,000 years, and those things don't stay around if they're not effective.
Mm-hmm. Absolutely. Obviously, if it wasn't helping women, they wouldn't continue doing it. And midwives, given what they see in their experience working with women every day, wouldn't continue to recommend them. So
that's right. And they are very, very important right after childbirth as well. As a woman delivers, depending on the culture of the country, some people do the vaginal steams immediately after childbirth. Some cultures deliver babies in the steam house. Other midwives think that a woman should wait a day. Anywhere from 1 hour to 9 days after childbirth is the recommended time for a vaginal steam. But if it hasn't been done, any time is the right time.
Okay. And why, just for the listeners who might have this question, but why is it beneficial postpartum right after you've given birth?
Well, because there are very likely to be retained fluids in the uterus. The steam and the essential oil help to really flush the uterus of whatever material might be left over after the childbirth. It also helps the uterine ligaments to return to a normal position. It brings warmth into the uterus. It brings warmth into the pelvic floor, into that area of the chakra system. It does so many things on so many levels. We're also every day finding out more and more benefits of vaginal steaming. But in our profession of myoabdominal therapy, it is a primary modality that we recommend for most women, barring that they are not in the area of contraindications. For those who are going through artificial fertilization, if they're going through assisted reproductive technology, ART, we have found that it is beneficial to do a vaginal steam on the day of transfer. On the day of transfer, the vaginal steam can make the cervix softer, makes the cervical fluid more abundant, and it helps the physician get into the cervix, into the uterus much, much more easily. It makes the environment more moist and slippery for the physician to be able to insert the zygote. Is that what it's called?
Mm-hmm. I think so.
Yeah.
And so the day of transfer, so whether the woman was doing, say, IVF or IUI, so she would kind of do the vaginal steam prior to seeing the practitioner that day, type of thing?
That's correct, yeah. And we find that it really makes for a moist, slippery, and easy to open environment in the cervix and the uterus. Our medical doctors who are even recommending that they do a vaginal steam on the day of transfer because it's a much more successful transfer, and that's good for everybody. That's good for the clinic, the physician, the woman, the husband, everybody.
Okay, and that was going to be one of the questions I was planning to ask as well. And also the role that the Maya abdominal therapy could play, especially to kind of in conjunction with women who are going through, assisted reproductive technology, kind of along that process.
Yeah, it's very, very helpful. We have a protocol for women who are having fertility challenges. It could be a month-to-month protocol, hoping that at one ovulation she might get pregnant, or we have a 3-month protocol where we ask her to try not to get pregnant for 3 months so that we can ensure her ovaries are producing eggs properly, that her uterine membrane is clean and moist and ready to receive a fertilized egg. I always like to tell ladies who come to see me, by the way, I'm retired now. I've been retired from clinical practice for about 3 years. But when women came to see me, my favorite line was, well, would you put a brand new newborn baby in a dirty crib? Well, we wouldn't put a fertilized egg in a dirty uterine membrane. So for all those reasons, we like to ensure on the day of transfer or the day of ovulation, if she's going to have natural intercourse, that her uterus be in as good a state as possible. It's just absolutely logical. And it is possible to achieve with very safe, non-invasive techniques from the ancient Maya.
Mm-hmm. Well, I had a question going back to the postpartum. And so after a woman has given birth, when she should, do the vaginal steam, is it while she's still bleeding, or is it after that bleeding has stopped?
No, while she's still bleeding, as long as she's not gushing, which is why I say I'm very happy to do the interview, but we cannot make blanket statements. It would have to be up to the midwife or her physician to decide that she is having a normal sequelae postpartum. Are things normal? If the physician or the midwife said, yes, this was a normal birth, and after 24 to 48 hours, she also seems to be recovering on a normal pattern, then we would be very safe to say, all right, it's a good time to do a vaginal steam. But we don't know that because every human being is an individual and every woman is her own unique puzzle, and every piece has to be put together with about 200 questions. You understand my point?
Yes, absolutely. And that actually brings me to another question I was going to ask. Because, so for women who are listening and now they've learned about vaginal steaming and you kind of walked us through how to do it. Now, is this something that women should be, doing independently, or is this something that we should be working with a practitioner, finding a practitioner within our area and or a midwife who's familiar? What would you suggest?
I think that the best idea would be to find a practitioner, make an appointment, learn the self-care, and get the proper instructions for the vaginal steam, which we have in a handout. She probably has the herbs for you to use as well. Many of our practitioners do it right in the office, right then and there. So then when you go home, you have had that experience and you know what to do. It's also important to know that you're not in the group of contraindications. So yes, my recommendation would be to find a practitioner. They can find it on the website, www.arvigotherapy.com. There are practitioners now all over the world. And I certainly highly recommend that midwives, nurse practitioners, pelvic floor therapists come to learn the techniques and learn to advise women when and how and why to do a vaginal steam.
Mm-hmm. Well, because of course, my aim with sharing this information is purely to I guess educate and inspire, and also to bring these amazing techniques to light. Because as I mentioned earlier, these techniques are not very invasive and very beneficial in so many different areas for women. But by no means am I saying, run out and go do it yourself without the proper instructions. So for all the women listening, we'll definitely be linking in the show notes to the resources, websites, and also a practitioner directory. You have a practitioner directory on your website as well. And so
yes, we do.
Yeah. And so if you're looking for more information, or if you're wanting to kind of incorporate anything you're hearing today into your own life, we'll definitely have the resources to help you do that. So you're not on your own when it comes to incorporating these things.
The vaginal steaming is very safe, but there are contraindications. That's the only concern. And that women need to be aware that after performing a vaginal steam, they are going to see sometimes really major changes in what comes out of their uterus, but it's always rather yucky. That's the best word for it. It's yucky stuff that comes out that you don't want to leave in there. And then dysmenorrhea, painful periods, just go away because your uterus has now dislodged what was kind of stuck in there. Often the severe cramping with menstruation is because the uterus is trying to do a really valiant job of cleaning out the membrane, but sometimes it's indurated, which means the uterine fluids haven't properly been moving and flowing, sometimes for decades, because the uterus has been too weak to do the job that nature intended it to do.
Mm-hmm. It just makes so much sense when you talk about it. And it just has so many implications for women, because so many women are suffering on a monthly basis with painful periods and all of these different problematic menstruation related issues, as well as fertility issues, because of course fertility issues are on the rise and more women are struggling. And so anything that is helpful, beneficial, that can support fertility and, of course, just enhance the optimal functioning of the uterus and all of our reproductive organs. I mean, I want to shout it from the rooftops.
Right, exactly. The best place to start is, first of all, let's just be assured that your uterus has a good blood supply, that your uterus is clean, that your ovaries have a good blood supply, and that they can function normally. Then the rest is up to nature. But those would be the most vital, fundamental issues to address first. And in our experience, probably 50% of women with fertility challenges simply need a good abdominal therapy treatment to get the uterus in maximum functioning order.
Mm-hmm. That just offers so much hope to women, and I think that's amazing. Yes. So we're kind of nearing towards the end of today's interview, but I do have a couple more questions. And one of the questions I wanted to ask you is the role of the Arvigo therapy when women have blocked fallopian tubes.
Well, it depends. If it's a blocked fallopian tube from infection, from PID, pelvic inflammatory disease, sometimes we're able to help, and then we like to recommend the castor oil packs. Castor oil packs for scar tissue is fabulous. That was my problem. I had blocked fallopian tubes. I used the castor oil packs, the vaginal steams, and the abdominal therapy, and I was able to conceive. So it depends. The blockage normally is from scar tissue. Sometimes they're blocked simply because the uterus is lying on top of its own fallopian tube, because it's fallen way over to the side, or both fallopian tubes and both ovaries have fallen into the pocket in front of the colon. These are the things that we can help with. So again, it's hard to answer.
Yeah, there's no one solution for all women.
Because as natural healers, we treat women. We don't treat blocked fallopian tubes. We rely on hemodynamics, which is the unimpeded flow of arterial blood in, venous blood out, and then homeostasis, which is nature's ability to bring and maintain all body functions to normal. That's homeostasis. And when you remove the blockages to homeostasis and hemodynamics, there's a miracle in store for everybody.
Mm-hmm. And it's a nice shift from, I guess, the typical medical practice, because of course, typically when you go to a doctor, they treat the thing that's wrong, as opposed to treating you as a whole person. And so part of what's so refreshing about talking to you is that if you were still practicing and if a woman came into your office, you're not looking at just one thing. You're looking at her whole self, her history, and also kind of examining her to see what's happening. Where is her uterus? What's going on? And so looking at her whole story and kind of starting from there. And I think that's a really important message that you've really
Right.
come across.
Yeah. We have a 10-page questionnaire. We want to know about your emotional health, your spiritual health, your family life, how you rate yourself as a generous person, you rate yourself as a happy or an unhappy person. All of those things have a great deal of meaning to us. Sometimes, women with fibroids, we find, we like to call it the unemployed uterus. Sometimes a woman, God bless them, everybody has a right to choose. Sometimes a woman decides she won't try to have a family until she's almost 40 years old. And the uterus, of course, was intended by nature to birth human beings, to reproduce. So sometimes the uterus decides incorrectly that if I can't grow a baby, I'm going to grow a fibroid. And those are the things that we like to look at. So we have to sit down with a woman, sometimes for a full hour, and just talk before we lay hands on her.
Mm-hmm. Well, one of the questions I also just thought of, maybe you'd want to touch a little bit on the spiritual aspect of what you teach. I mean, we've talked a lot about the specifics of the therapy, but I know a large portion of what you do and what you teach is actually kind of the spiritual aspect of the Mayan teachings. And I'm not sure if you wanted to touch on that a little bit.
Yeah, well, the Maya spiritual healing, it's a week-long course. So if I put it down into a nutshell, or we call the elevator speech, it's a way of looking at, for instance, recent or past traumas, PTSD. PTSD, for instance, is a massively responsible for so many physiological problems that men or women can experience, because it shuts down the immune system, it shuts down the normal responses to the body. The muscles are tense inside, below the level of awareness, so that blood flow doesn't move properly. So if a woman has had a recent trauma, a big fright, or a great loss, that would be the first thing that we would introduce through Maya spiritual healing, which involves prayer, herbal bathing, and burning of incense. So once we have done that, then we would prefer to move on to the physical. But most often we find that many people, men, women, and children, are really suffering from emotional/spiritual disorders. We name them as fright, grief, anger, sadness. There's a whole range of different spiritual ailments that we can recognize. And then they're all treated the same way, through a series of prayers, through herbal spiritual bathing, and burning of incense. And the most important part, all of it is important, but one of the most important parts is just talking. It's called la plática, which means the conversation in Spanish. We ask a woman certain questions. How long have you been feeling this way? When did it start? And was there a traumatic event that occurred at the same time as the onset of your physical symptoms? Bingo! Everybody knows. Everybody knows. You hear things like, ever since my father died, my menstruation has been awry. Ever since my mother took sick, I haven't had a normal period. Ever since my husband left me, everything has been wrong in my life. So those are the things. We don't get the husband back. We don't bring the dead back to life, but we help a person deal with the emotional and spiritual residue and the after effects of those events that everybody who is alive has experienced or will experience. Nobody escapes those emotional/spiritual ailments.
Mm-hmm. And they're all connected. And so I really love the way you described it. And it goes in kind of perfectly to what we've been talking about, which is that you treat the whole person. And in addition to treating their physical symptoms, we're also looking at their emotional state and also what's been happening. And that's very interesting and also very powerful to know that obviously when you have certain physical conditions that they can be and are often linked to specific emotional experiences that have happened.
That's right. You got it.
Well, I like to end with a few, well, I wouldn't really call them rapid fire questions, but just a few questions to end the show. And so one of the questions I wanted to ask you is if there's one thing that you could tell women about traditional healthcare or kind of the lost wisdom when we're kind of moving towards our modern day fast-paced societies, or for any of the listeners that are listening along and this is new for them and maybe they're a little bit skeptical, what would you say to that listener?
I would say that traditional healing has been the primary mode of healthcare in many, many countries around the world, and that the World Health Organization, in one of their major international meetings, declared that traditional healing was the primary mode of healthcare for most people in the world, and that the traditional healing systems and methods and tradition and wisdom was deserving of being preserved. So in general, I would say to women who don't have the benefit of a Maya traditional healer, as my teacher said, it's only natural to go see a medical doctor after herbal remedies, massage therapy hasn't helped. At least give natural methods a chance before you decide to jump into the swimming pool with drugs and surgery.
Yes, I couldn't agree more. And what do you think is, I guess, one of the most common myths or misconceptions or misunderstandings about fertility or about kind of the female reproductive system that you would like to see corrected?
I think that the most common misunderstanding is that the uterus is beyond daily consciousness of women. By that, I mean that most women are absolutely disconnected from their uterus. And we feel that the uterus is like a second brain. We always say it's true. Women really are smarter than men because we have two brains. And the uterus is one of those brains. So one of the things we do in our sessions is the uterine meditation. I think that it would improve peace on earth. I think it would improve the presence of the divine feminine if women were able to have more intimate contact with the uterus. One of the things we recommend is to rub your hands together, get them warm, and lay your hands over your lower pelvis, right around where the uterus and ovaries are, and just think of all of the menstrual cycles she has produced for you, the baby she has grown, if she has, and the lovers that you have shared together, and reconnecting with our internal divine organ, which is the seat of the Great Mother, I think will bring a great deal of peace and understanding around the world. So to me, that is the greatest misconception, that the uterus is a muscular organ and that it has no connection to the psyche, the emotions, or the soul. When we believe that it is the psyche, it is the emotions, and it contains the soul.
It was beautifully stated.
Thank you.
Yeah, I don't even know where to go after that. I was quite moved actually. And I think part of the reason, I always say this, but as a mother, so I have a son, he's 2 years old. I feel like after having gone through kind of pregnancy and birth, if you don't have a renowned respect and kind of love for your body and the ability for your body to grow a baby and to keep it safe and to nurture and support this growing life. I mean, for me, that's having gone through that experience. It's just so meaningful to me because I guess in our culture we're kind of detached from really
We are.
revering our bodies and.
That's true. We are detached. And when you look at your little son, you have to give thanks for your uterus.
You do.
Your uterus that accepted that little baby when it was microscopic and then day by day grew into a human being. It's a divine chore. It would be absolutely impossible for any other aspect of life to make a human being other than the uterus. So how magnificent, how holy, how sacred, could not be more holy and could not be more sacred.
I couldn't agree more. Well, on that note, that seems like a wonderful note to end on. So before I let you go today, how can our listeners get in touch with you and find out more about the work that you do? Of course, I'll be linking to your websites. So I have your website, which is rositaarvigo.com. And then I also had the website for the Arvigo techniques of my abdominal therapy, which was arvigotherapy.com. Are those the two main places if our listeners want to get a hold of you or just to see the work that you've been doing?
Yeah, those are the main places. I would say that before a listener contacts me, go on the web and see if there is a practitioner in your area first. If there's no practitioner in your area, you can send me a note on the contact icon, and I will most definitely answer. But primarily, if you write, my first response would be to try to find you a practitioner in your area of Maya abdominal therapy. So do that first, and then, yeah, sure, people can send me questions or notes from the Rosita Arvigo website. That would be the best.
Okay. Well, Dr. Arvigo, I just want to thank you for sharing your, being so generous with your time today and coming on the podcast and sharing your wisdom. I know this episode is going to help thousands of women. Just the information you've brought, the insight, the wisdom, the knowledge, the experience, and just the way that you look at the world. I'm just very thankful that we were able to spend this time together today.
Thank you, Lisa. I enjoyed it very much, and God willing that it is able to help thousands of women. That gives my life meaning. So thank you for the opportunity, and blessings on you and your family.
Thank you so much. Thank you for listening. If you enjoyed today's show, please share it with a friend. If you haven't yet subscribed to the podcast, just search for Fertility Friday on iTunes or Stitcher and make sure to subscribe so you never miss an episode. And of course, if you're loving the show, please leave a review on iTunes so that more listeners can find it. Of course, a 5-star review would be awesome, but leave an honest review and let me know how I'm doing. Let me know if you're enjoying the show. As for me, you can find me on Twitter at Fertile Friday. You can stop by the blog and leave a comment in the show notes for today's episode, which you'll find at fertilityfriday.com/Rosita Arvigo. And you can also find me on the Fertility Friday Facebook page, which is facebook.com/Fertility Fridays with an S. And as always, until next time, be well and happy charting.